Newsflash, we're all getting older. All right, maybe that's not news.
No,
but your teeth are always shifting and changing the older we get. Dr. Stephen Marsh, it's great to spend some time with you. Let's talk about this because our teeth can actually drift the older we get, which means problems.
Problems. And usually, oftentimes, we call it a midline shift. Teeth tend to want to move towards the midline. And even if you've had braces, it can be a problem. So we tell teenagers and adults who are getting braces or clear correct, something like that, that after they're done, after the work's completed, they need to wear a retainer to maintain that. Now, it may not surprise you, women are better about wearing retainers than guys. Oftentimes they end in the drawer and the teeth shift, and it sort of undoes what they've had done. But also people have had a lot of restorations, fillings, crowns, and over time they're not always put exactly where they should be put, and as a result the teeth do shift, and that's what we deal with as cosmetic dentists.
It's kind of like a checkup and make sure that things stay in the place that they were originally put.
Yeah, and you like that too because as teeth shift, they also attract more food, and so as you get older, you tend to collect more food between teeth, and it's our job to minimize that.
So let's talk about some of the patients that you've helped with drifting and shifting teeth.
Okay, I appreciate that, Joe. So the first one's Michael. Now, oftentimes you and I specifically talk about upper teeth. This is somebody who was in his 50s, and he had braces as a kid. It's hard to believe. And they've shifted quite a bit. And so we talked about what could be done. He said, I'm not going through braces again. And so we did 8 porcelain veneers. We reshaped the teeth. We made them look ideal. And we did insist that Michael wear a retainer when he's done, and hopefully he'll do that at least every other night or so. So we talked about shifting, and Myra had actually lost some teeth, and you can see how badly worn her teeth were. So it's a combination of wear and shifting, and she said, with her husband's support, I think it's time to get my upper teeth done. She had had a bridge done many years ago. It looks a little bit artificial. She wanted something to look a lot better.
Very natural.
Thank you. So we did porcelain veneers. We did 10 of them, and she said it's made a huge difference, and you can see that beautiful smile and lip formation. So Jill actually was a friend of one of our hygienist moms, and over the years her teeth had shifted. You can see the lowers actually took on a slant. The uppers were sort of all over the place and very worn. And in her case, Joe, we did something different. We did 4 upper teeth and 4 lower. We may do more in the future, but that's what really bothered her. And when you see the smile before and after, what a difference. So we did 4 porcelain veneers on the upper, 4 on the bottom. And she said, given time, she'll do more, but she loved the result and was so glad, as was our hygienist who brought her here. And the last one was Michael, and for years he took care of his family. Thank you. He was actually 71 years old, didn't like the spaces. You talk about shifting and teeth that had broken down. For years we enjoyed meeting each other. Both of our grandfathers were tailors. We got to be friends. We did his whole upper arch. And in the next week or so, we're going to start on his lower arch. But it not only looks better, but the shifting with the teeth in tight approximation, they should not shift anymore. So he was thrilled with the result.
It's truly incredible, the transformations, and you get to see this every day.
Well, it's one of the most gratifying parts about being a dentist, and we love being part of their journey.
Well, the first step of taking this journey is to call Dr. Marsh and his team right now at 440-461-1003 or log on to the website. It's a great name for a website.
Thank you.
clevelandsmiles.com. Thank you, Doctor.
My pleasure.